So let us get an overview of the chapter Role of Government in Health. So this is the chapter of class 8 civics, and we will just go through the chapter and get an overview of the chapter. So what is health? Health means not just being free from illness, but also being able to live a healthy and happy life, that is physically, mentally and socially. Since the whole chapter is about the health and the role of the government, so we will try to understand the meaning. And health means not just being free from illness, but also being able to live a healthy and happy life. And it will be done only when you are physically, mentally, and socially healthy, isn't it? So, this is our health. Now, good health depends on certain things, and what are they? So, good health depends on clean drinking water, after that, pollution free environment, and then nutritious food, that is a must, proper medical care, and mental peace and security. So, if all these things are there, then your health will be good, right? Now, why is health a national concern? So, as we move on the chapter, we just have to go through this topic also. Why is health a national concern? Health is not just an individual issue, but it is a public issue. It means, so this is an issue of the whole country, the people, those who are living in that country, right? So that is a government issue. It is a public issue. If garbage is not collected and water is not clean, diseases can spread quickly, isn't it? So if garbages are not collected and clean, water is not there, then what happens? Diseases can spread quickly. Apart from it, mosquitoes breed in stagnant water. So where the water get just stagnant there and they can't able to flow, then what happens? Mosquitoes begin to breed there and causes diseases like dengue and malaria. Poor people suffer the most as they cannot afford private treatment. And that's why the government has a major role in health care. So that's why health is a national concern. As if the garbage are not collected and then it will help in spreading the diseases, then poor people are the worst sufferer as they can't able to afford private treatment. That's why government has an health concern. Okay. So that's why health is a national concern for the government. Now, what is the role of government in health? Let us see how government is helping the people of India just maintaining a good health. First of all, it are providing public health services. Okay, the short form is PHS also, that is the public health services. In this, government used to build hospitals, health centers, dispensaries and private health centers, right? So what did they do? They just build hospital, health center, dispensary and primary health center. Okay, primary health center, that is PHCs. And it provide vaccination for diseases like polio, COVID-19, etc. Right? So these are the initiative of the government. Apart from it, government runs campaigns about hygiene, nutrition and disease prevention. As prevention is better than cure, isn't it? So government used to run the campaign about the hygiene, nutrition and the disease prevention. These services are either free or low cost, especially for the poor. So here we have seen, first of all, providing public health services to the people. This is the first role, right? Next, controlling the spread of diseases. Government agencies control waterborne and vector-borne diseases. However, waterborne diseases, that the diseases borne through water, isn't it? Dirty water. Vector-borne diseases are illness transmitted to humans and animals by vectors like mosquitoes, ticks or fleas. These vectors carry pathogens like the virus, bacteria or parasite and transmit through them through bites or other contact. Okay, so these are called vector-borne diseases. So government agencies, what did they do? They control waterborne and vector-borne diseases. Apart from it, they provide clean water, drainage system and garbage collection also. During outbreaks like the cholera or the dengue, health teams are sent for awareness, testing and treatment also. Okay, so in this way, government control the spread of diseases. After that, government also just keep health as a fundamental right. So the Indian Constitution, that is Article 21, guarantees the right to life, which includes the right to health. The government must ensure that everyone, especially the poor and underprivileged, gets health care. Courts can order the government to provide medical care if someone's right to health is violated. Apart from it, court can also give the order to the government to provide medical care if someone's rights to health is violated. So health is a fundamental right. Health budget and planning. Government spends part of its budget on healthcare. It sets up schemes and programs like National Health Mission, Ayushman Bharat, Midday Meal Scheme that improves the child nutrition. So these are the four roles of the government of India in health. First of all, that is the providing public health services, right? Secondly, controlling the spread of diseases. Third, health as a fundamental right. And fourth, health budget and planning. Now let us see public and private health services are also there. What is public and private? So public, that is run by the government, and private, that is run by individual or companies, right? So public health services run by the government, and here affordable for free also, isn't it? Example, government hospitals, primary health centers are the public health services. However, there are some problems also in public health, that is we have to face long queues, right? Sometimes poor infrastructure is also seen. Shortage of doctor and updated technology is missing is also seen in public health. Private, whereas as compared to private health services, it is run by individual or companies, and it is expensive. However, it gives better infrastructure, but the treatment is expensive and is meant for people who can afford to pay. Now, what is the need for equality in healthcare? Healthcare is a basic need, so it should be available to all. But in reality, rich people get better care while poor people suffer. The government must reduce this gap by improving public hospitals, making medicine affordable, and increasing awareness. So if government will work in this area, then we will see some equality in healthcare. So as we proceed in the chapter, there was an example has been given from Costa Rica. That is, Costa Rica is a country in Central America. It is known for providing excellent public health care. It has no army and uses that money for health and education. So government health services are free and people live healthier lives. So this is an example that the government of Costa Rica is doing so much for its people, right? So health is not only a personal matter, but it's a public responsibility also, isn't it? And the government play a key role in providing hospitals and services. Apart from it, just it help in preventing diseases also and making healthcare accessible to all. Now, if we are going to talk about both public and the private health services, then there must be fairness and equality in health access, isn't it? So then only we can say that the role of government is good. So this was for the chapter, that is what is the role of government in health. We have just gone through the chapter and get an overview. So in detail we will cover this chapter also. So this much for this video.